introduce myself really quick as well. My name is Richa Shazbase, and I'm the Director of Billing at United Medical. I've been with the company for 11 years now, working in the revenue cycle management side for the majority of my tenure here. So today we're going to talk a little bit about the practice management system that we use and our check-in and check-out process at the doctor's office side. So just for the folks that don't even, maybe know what a practice management system is, it's essentially our system that we use in our offices and at United Medical to schedule our patients, put in all of our patients' insurance and demographic information, and also do all of our billing out of. So, when you come to the doctor's office, you see the doctor for a visit, and maybe you may have, a procedure done, or you may have something checked out, a lab, whatever it may be, that goes into a system and then it gets processed. And we basically, get your insurance companies to either pay, deny, reject, all of these things, your claims, essentially your medical claims, so that it can be processed through the system and, be taken care of. Most of the time taken care of by your insurance company. The claim can be taken care of by them. So the practice management system that United Medical uses is called SPM, Specialty Practice Management. And we have been using that system from 2006 to present primarily. That is our main system. 90% of our clients are utilizing this system. We've also transitioned a number of clients from other Cerner practice management systems into SPM. Specifically, clients that used to be on a system called Wisdom, which was primarily for podiatry clients, and also a system called PDS. So we've been working closely with Cerner to get a lot of those clients onto SPM because that is our expertise. That's our area of expertise. And we do also have a very cool bi-directional connection to our EMR system, at least for our United Medical clients that are under the United Medical domain. And essentially, we have our own little domain with all of our practices, and they can share information in our EMR, which is very cool. And actually, we also are able to share patient demographic information through our specialty management system now. So if you go to one of our doctors, our PCPs, and then you want to go to one of our specialists, it's actually very cool. We can just search in the system. And if you're already existing in our system, that new practice, that new specialist that you're seeing will easily be able to find you in our system. Kemal, before I move on, is there anything you wanted to ask or add?
So I think one of the reasons, as I was actually, while we were waiting for you, we were just trying to tell people why we are doing these sessions, these presentations for the RCM side. So of course, part of it is we want to be able to reach out to our own people, our employees on the business side, our clients. So yesterday, of course, I won't mention the client name, but when we had that call with the out-of-state client, it was kind of, again, eye-opening for me how important this communication is, because what happens is, as we know that clients already know everything that we do, that is a false assumption. So, because they don't. So yesterday, it was kind of like, we've been working with the group for, 5-6 years now? Mm-hmm. And they pretended like if we never had these reports or these process explained to them. And that was kind of, I wasn't disappointed because I'm used to that by now, working with being in business. But I think it just reminded me of why we should be doing these types of events so that our clients and then employees can actually understand and then know better. So
absolutely. I think what we learned from yesterday is communication is the most important part of this business. And if we do not have consistent communication lines open between our organization and the doctors, we will inevitably fail for sure.
Yeah.
So the next thing I wanted to kind of talk about is check-in and check-out. which is our topic today. So when you guys, as patients, go to a doctor's office, normally there is somebody to greet you at the front desk, and that person is responsible for a lot of important tasks. One of which is, potentially even before you get there, gathering your insurance information, telling them what your date of birth is, what your social security information is, where you live, what your phone number is, your email address, potentially, if the practice is utilizing a patient portal, which all of our practices we encourage to do so for communication purposes. So this individual at the front that you're talking to is not just sitting there and doing nothing. They're responsible for a lot of key parts of what affects your claims going through the system and your visit being processed for visiting the doctor that day. So they collect that information. They often may give you a sheet and say, has anything changed? They may, also ask you for a copay. If for your insurance, you are required to pay, $10, $15, $20 to see the doctor that day, they'll collect it at the time. If you didn't pay your previous bills, they may mention to you, hey, you have a bill from the past. Do you think you can pay a portion of it or all of it? So these are all very important parts of the, practice flow. And our practice management system is set up very, very user-friendly to help those folks kind of go through that process and make sure it's easy for both the patient and them to go ahead and process all of that very pertinent information. Yep. So, and then also that same person, or maybe somebody else, when you're leaving the office, is doing something called checkout. So this person is very likely giving you labs that you may have to get done, or tests that you may have to go get done that your doctor has recommended. They're also maybe setting you up for your next appointment. And they may also be giving you any data that you may need to, triage you to a different place, or, whatever your doctor has recommended. And also that person is often responsible for your claim that day. And when I say your claim, like I said, when you come in for a visit, you are going to have a code attached to that day for the services that you had, and that's going to be billed out to your insurance. So that individual is usually responsible for things like putting in your correct diagnosis, or at least checking what the doctor has put in and making sure that it's valid, adding any billing related modifiers or codes or information that is needed for that particular day. They're essentially there to make sure everything on your visit is valid and correct before it gets to us at United Medical. And once we get that information here, we essentially take it, we scrub it one more time, we make sure it's all good to go, and we send it out to something called a clearinghouse. Our clearinghouse partner is TriZetto, and they process all of our medical claims for us. And what they essentially do is they make sure, again, on another level, that all of your information is correct and it can go out to the insurance company. So once it's out to the insurance, we get it back, and we have a whole process, which Kemal, I can go through next, unless we want to stop here for a second.
We can go through this.
Perfect. So yeah, so once your claim is out the door from our clearinghouse and it gets to the insurance company is going to review the information we sent them, and they're going to process it. And they're going to say, okay, we've got the patient's name, the patient's ID number, their diagnosis code, anything that's related to that service you had that particular day. They're either going to pay it or they're going to deny it. If they happen to deny it, we get that information back in our system. We get it back in the clearinghouse, and we also get it back in a system called Reimbursement Manager, in which we work our denials. So perhaps it may say something like, incorrect insurance ID, or incorrect, or it would say incorrect ID relation to, something along those lines. And when I say relation to, maybe it's a child, and the claim has something to do with their parent, and it hasn't been connected properly. So we look at that denial, we fix it in our accounts receivable department, and we go ahead and shoot it back up to the insurance to be processed. And that process would continue, a few times if necessary, especially if there are claims that are more complex. Maybe something where you had a surgery where your authorization was missing or something is wrong with your diagnosis code. So there's a lot of back and forth between the insurance company and our organization to make sure that the services you had that day get paid and our doctors receive that money and you particularly don't get the bill, right? Our goal is also to make sure that everything is being processed correctly so our patients are not billed erroneously. Because we know that that's a lot of stress on patients to receive bills. They don't know what to do, especially if they're elderly patients who are not familiar with this process. So our goal at United Medical is always to process the claims as clean and efficiently as possible so that our patients can avoid receiving bills that are not necessary and that our doctors get paid. So that's essentially the process that we go through. The only other item to mention is the majority of our claims processing is electronic, the scenario I just described. However, we do have some insurances that require us to mail items via the snail mail, old mail process. So we do print out claims sometimes, and we often send them out to the insurances that require that. And that process is also the same. The only difference is it often takes much longer, and the correspondence we receive from those companies has to come through the mail. The mail has to be sorted, it has to get to our desks, and then we would review it, fix it, and get it reprocessed again. So that's essentially the process in a nutshell.
Well, I think it's one of the most important part of the medical offices because, as I always say, garbage in, garbage out. So if you don't get good information, good data, clean data, then what we are going to process is not going to be clean. So that is one of the reasons that we also wanted to discuss this at this in this format. Also, understanding when we are providing these services, we are not like a third-party billing company because we use the same software, same system, real time in these offices. So whatever we see is what they see, the clients see. Therefore, there's no unnecessary communication delays because we are able to show everything that we are doing, and then we can also see everything that they are doing in the offices. So
absolutely, we create notes, right, in the system and alerts that we can communicate back to each other directly in the system. So that front desk staff person can see all the notes that we're putting in. And if they happen to put in a note, we'll be able to see that as well.
Absolutely, absolutely. So, Richard, thank you so much for joining us.
Thank you.
I don't know, Sean, did you have any questions for?
No questions. I just want to hit again. I know Richard brought up that communications, kind of one of the pillars, and I think she kind of just demonstrated and laid that out on how this process, like you're saying, with garbage in, garbage out, it's kind of the first step from that very moment the patient's checked in, and how collecting the sufficient information is going to be such a crucial step down the road with the rest of our what our team does here in the office to make it the most efficient process as possible. So I would definitely agree on what she said with the communication.
Yesterday, though, the client got upset when I said garbage in, garbage out. So he's like, "Well, I thought you were cleaning the garbage, but that's not until we process the garbage. So it's not like we know it right away. So we need to. This is the time of getting this information is at the time of the service. In some cases, even prior to the day or two before the visit. And otherwise, we do spend even more time to fix it, not just from the billing side, but from the client side, because they would lose money. And in some cases, patients are upset because they don't have the right information. So we don't want to upset anyone, and we want to do our job at the best level that we can. So, Richard, thank you so much for joining us.